Your healthcare needs are yours alone, so you'll want a prescription drug plan that will help you enjoy your best health and a company committed to you. Humana supports you beyond what you'd expect from a health plan. In ways large and small, we work to help members feel their healthiest. We call it Human Care, and it lives in all of our plans.
A Medicare Part D plan is a prescription drug plan. Humana Prescription Drug Plans, or PDPs, are Medicare Part D plans.
We'll walk you through all the information you need and help you enroll in the right plan for you.
It's important to know when you're eligible to enroll in or change your Medicare plan. The Medicare Advantage and Prescription Drug Plan annual election period is October 15th through December 7th. During this time, you'll learn about your options and you may enroll in or change your plan. It's important that you not submit your application before October 15th. The Medicare Advantage open enrollment period is January 1st through March 31st. That's when Medicare Advantage members can change to another MA plan or return to original Medicare. The initial enrollment period for Part D drug coverage is generally the same as for Part A and Part B. During the rest of the year, if certain conditions apply, you may qualify for a special enrollment period. Ask your licensed Humana sales agent if you may be eligible.
Let's think about your Medicare options. Option 1 is Original Medicare, Parts A and B, through the Centers for Medicare and Medicaid Services. Parts A and B help cover many hospital and doctor costs, but not prescription drugs. In order to enroll in a Medicare Advantage plan, you must have Medicare Part A and Part B and live in the plan service area. With Original Medicare, you may need a separate Medicare Part D prescription drug plan. If you do not select a Part D plan when you're first eligible, but enroll in one later, you may have to pay premium penalties for as long as you have your prescription plan.
If you enroll in a standalone PDP while you're already enrolled in a Medicare Advantage plan, in most cases you'll be automatically disenrolled from the Medicare Advantage plan. So if you have Medicare Advantage, be sure to talk with your agent before enrolling in a PDP plan. Prescription drug plans are subject to a coverage gap, when you may pay more for prescriptions.
Option 2 is Original Medicare, plus a Medicare Supplement Insurance Plan, plus a prescription drug plan. A Medicare Supplement Insurance Plan, also known as a Medigap policy, helps pay some of the costs Medicare Part A and Part B don't cover, such as deductibles and coinsurance. But Medicare supplement plans don't include prescription drug coverage. That's why you may need a separate prescription drug plan. If you think you may have trouble paying for your drugs, you may qualify for the Extra Help program through Social Security. Option 3 is a Medicare Advantage health plan, also called Medicare Part C. Many Medicare Advantage plans also offer drug coverage. You can get a Medicare Advantage plan with prescription drug coverage, or MAPD, through private companies like Humana. So to recap, you can get a standalone Part D plan, or you can enroll in a Medicare Advantage with prescription drug plan. Those are the two ways to get prescription drug coverage. The federal government, which offers Medicare Part A and Part B for doctor and hospital coverage, doesn't offer prescription drug coverage.
The Centers for Medicare and Medicaid Services prohibits combining a standalone prescription drug plan and a Medicare Advantage HMO or PPO, even if the plan doesn't include prescription drug coverage. Only PFFS Medicare Advantage plans may be combined with a standalone PDP. Ask your sales agent to review your options with you. This is important too. Prescription drugs are organized into 5 tiers based on their specialty use and price. A Tier 1 drug will be more common and less expensive than a Tier 5 drug. Different plans cover different tiers in different ways. Your licensed Humana sales agent can tell you more about this.
Now we'll dig a little deeper into Humana Medicare Part D plans. There are 3. The Humana Walmart Value RX Plan, the Humana Premier RX Plan, and the Humana Basic RX Plan. Each offers coverages and premium prices to meet member needs. Our PDPs are designed to fit your budget and your life.
The Humana Walmart Value Prescription Plan is designed to help save you money. The monthly premium is competitive, and you may save even more money when you fill your prescriptions at a preferred cost-sharing pharmacy like Walmart, Kroger, Humana Pharmacy, and others. The Humana Premier Prescription Plan provides members with the security of our most comprehensive prescription drug plan with a robust formulary and low copays at preferred cost-sharing and standard cost-sharing pharmacies. Our Premier Prescription Plan also participates in the Part D Senior Savings Model, which Humana calls the Insulin Savings Program. The Humana Basic Prescription Plan is particularly appropriate for members who qualify for extra help, which may cover the cost of the premium on this plan. This plan offers basic coverage and low copays at preferred cost-sharing and standard pharmacies. You should also know that Humana's network includes more than 60,000 pharmacies nationwide, including 20,000 independent and mail-order pharmacies, like Humana Pharmacy. To find a pharmacy, visit humana.com/pharmacy locator.
Now that you know your PDP choices, how do you choose your plan? Here are some things to consider. The prescriptions you take now, daily medicines or specialty drugs, whether your prescriptions are on the plan's drug list, what share of the cost you pay each month, any benefits you may get from the Veterans Administration, TRICARE, Medicaid, or your state's Pharmacy Assistance Program. Your licensed Humana sales agent can help clarify how these fit into your overall PDP and health plan needs. If you have a question, hit a barrier, or want to see if there's a better way or a better price, we're here to help with whatever you may need help with. You'll want to have your agent review the plan's prescription drug coverage and specific drug list, the medicines the plan covers, with you. Even if your medicines are listed, Humana may require you to try certain drugs first to treat your health problem before we'll cover more expensive drugs. This is called step therapy. Some prescriptions require prior authorization from Humana. Manufacturers must agree with CMS's terms and conditions to contract with Medicare, so not all brand name drugs may be covered. In the coverage gap, you pay part of your drug costs before additional prescription drug coverage kicks in. In 2022, you'll pay no more than 25% of the cost of many generics and brand name drugs during the coverage gap. If you have both Medicare and Medicaid, you may be eligible for another type of Medicare Advantage plan with prescription drug coverage. Ask your sales agent if a dual-eligible special needs plan is a good choice for you.
Now that we've talked about when to sign up and prescription drug coverage, let's get you ready to enroll. Your sales agent will go over 3 important documents. One is the summary of benefits. The others are the plan's star rating and its drug list.
If you sign up for a PDP, we'll send your ID card in the mail. You can choose to receive other plan documents online. If you decide to go digital, we'll email you a link to activate your secure online account called My Humana. By providing your email address, you authorize Humana to send you health information to this address. So it's important to let us know if your email changes. We've covered a lot of information today, but if you have questions, contact your licensed Humana sales agent. Another great resource is the Medicare and You handbook you should have received in the mail. You can also go to medicare.gov. At Humana, if it matters to you, it matters to us. That's human care. Thank you for your time and interest today.